get started. Yeah.
All right. Well, greetings, everybody. Of course, I have to say Happy New Year, Happy 2024. This is Alice Bonner, Chair of the Moving Forward Nursing Home Quality Coalition, and this is one of our coalition conversations, and we're just really, really glad to have all of you here today. A number of us are going to be speaking, and we're going to be going through some of the material fairly quickly because some of you are familiar with the basics, but we wanted to go into more detail in a number of the areas, and we're going to do that as well. So I'm here with Isaac Langabardi, our director, with Sumeri Maki, our associate director, and Ramal Parekh, who's going to speak to us in a moment. So next slide. This is our vision and mission, and we always remind people that this is what we're about, and it's on our website, and very important to always ground ourselves in where we're going and what we want to accomplish. Next slide. You know, this is based on the NASEM report that came out in 2022 on the imperative to improve nursing home quality, and that's what we're funded to do. We're only funded to focus on this report and nursing home quality. So it's important to remind ourselves of that. And many of you are very familiar with this report. Hopefully you all are. Next slide. So what we want to say is, you know, people were worried that this report was just going to sit on a shelf and nobody was going to do anything with it. And our job, as you know, we were funded, is to take this report and really turning into something meaningful, to prioritize a handful of the, you know, recommendations and to create action plans. And we'll talk about the action plans that the work groups have developed over the last year and a half later in this presentation. Next slide. So you've probably seen this before. This is our journey map. It shows, you know, where we started and where we're going. But the next slide shows where we are right now and really focuses on the testing phase, engaging nursing homes, doing some pilot work or getting ready to do some pilot work, and really engaging policymakers on some of the action plans that you'll hear about, and continuing to really build and expand partnerships and build momentum around the country. Next slide. So with that, I'm going to turn it over to Ramal Parekh, who's been part of our work group and is going to talk about what they've done specifically related to goals, preferences, and priorities, and some work on that action plan. So Ramal, over to you.
Thanks, Dr. Bonner. Greetings, everybody. My name is Romil, and I'm a research fellow at the University of Minnesota. Our group was tasked with conducting a literature review to inform the background for quality improvement, which is like an ongoing process for all nursing homes in order to measure goals, priorities, and preferences. And I'd just like to acknowledge our team members. We had 4 faculty volunteers, Dr. Tonya Roberts, Dr. Tatiana Shippey, Christina Ramsey, and Dr. Mary Luke Ciolfi. And we also had student volunteers, 5 of them, Jingzi, Megan, Sora, Amelia, and me. And next slide, please. So in this literature review process, we had 2 components. First, we scanned all the research articles that have been put out there by researchers. And secondly, recognizing that a lot of good solutions are often born pragmatically out of need, and they might not be covered in proper academic literature. We also went through blogs, websites, and reached out to experts to find tools that have not been studied in a research setting. And using information from both these components, we finally curated a list of tools and domains. Next slide, please. So the first thing I will be discussing is our peer-reviewed literature search. In this, we went through 3 databases, scanned 3,400 abstracts, out of which we narrowed down 214 articles. And upon reading all of these 214 articles, we identified 24 studies which had been shown by researchers to be the good ways to measure goals, priorities, and preferences among nursing home residents. And there were 2 things we were specifically looking out for. Firstly, we wanted to see what were the different qualitative aspects of goals, priorities, and preferences that were being measured out there. And secondly, what were the tools used to measure these domains or qualitative aspects? And so from our peer-reviewed literature, we found 28 tools or sets of questions, and these were covering about 17 domains or different aspects of goals and priorities and preferences, such as quality of life, security, control, autonomy, etc. And among these tools, we also found that there were broadly two categories of tools. The first category, which was more common in this academic formal literature, was a set of evaluative tools, which are often used by administrative agencies and others to check whether certain processes are being carried out or not. These are a good way to make sure that certain policies are being implemented, but they do not allow us to generate the actual goals, priorities, and preferences for residents. Then we have a next set of tools, which are generative tools. These tools are more open-ended and freestyle. It's more of a conversation between the provider and the resident. And these open-ended tools are often extremely important to identify what are the priorities, goals, and preferences for nursing home residents. And so we had a total of 23 evaluative tools and 5 generative tools in the formal academic literature. Next slide, please. After completing this formal academic literature search, we also went through different non-research oriented sources, for example, different blogs, websites, or even tools in the academic literature which were not necessarily tested for their validity. And we also reached out to experts via surveys sent out even to the Moving Forward Coalition members. And in this set of search, we found that there were 35 tools and 23 domains. And among these 35 tools, there were about 22 that were purely evaluative, and there were 15 tools that were generative. Next slide, please. So as we can see in the formal academic set, we found that there were a lot of quality of life and satisfaction surveys, and most of them were evaluative, and they weren't necessarily helpful in generating GPPs. Whereas in the gray literature set, which was like a set of more open-ended tools that have not been tested by researchers, although they lacked validation, they were extremely important in actually finding out that what are the goals, priorities, and preferences for the residents. And we also identified different domains or aspects that were being measured by these tools, which include QOL or satisfaction aspects such as comfort, environment, or what activities are meaningful to the people, and whether they are secure in their environment and whether their food preferences are being met. The second broad category was of identifying preferences for residents. What are their daily routine preferences? What are their activity preferences? Or even what are their mealtime preferences? And the next set was care experience, which includes aspects such as control, whether residents have a control over their care process, their care setting, or even their environment, and whether they have autonomy in the shared decision-making process. The next broad category was well-being, and this included social, mental, physical, and spiritual well-being. And finally, the next broad category was providing person-centered care, which included aspects such as long-term or short-term goal setting, or even general goal setting, and identifying what are the priorities for the residents. Based on this, we identified that there were a total of 23 distinctive aspects or domains. And our next step is to prioritize which of these domains are important, because we recognize that in the limited resources that facilities have, it might not be possible to use all the tools and all the domains. So with the help of our committees, our next step is to identify which domains should be prioritized by nursing homes based on the amount of resources they have. And we'll suggest what tools can be used to measure these domains. And with that, I'll pause for a few questions and then hand it over to Samire. Feel free to ask any questions.
Folks, if you have questions, you can either put them in the chat or raise your hand.
All right.
I know.
I'll hand it over to Samire.
Thanks, Rommel. And if not, we'll have some time after my presentation and at the end of the call for questions as well. So feel free to chat them in. Rommel, thank you so much for joining us. I know you're limited on time. This was such a great snapshot into the action plan addressing residents' goals, preferences, and priorities. Thank you, the team and the students for the work on the literature review. I know it was a significant amount of work. We just really appreciate it.
Thanks a lot.
And before I go into how we have been and will be using the information Rommel's laid out for us, if you aren't familiar with the action plan on addressing resident goals, preferences, and priorities, or GPPs, the coalition aims to develop these three resources in the right green box over here to support standardizing the process of understanding residents' GPPs or what matters to residents and aligning that to their care delivery. And we know that, there's some great practices that already exist. And we also know from recent key informant interviews and surveys and conversations with providers we've done and had that these processes vary a lot across nursing homes. And to address what matters to a resident, we've set out to develop these three resources that we've outlined here. First, a guide for staff to address residents' goals, preferences, and priorities, including a process for collecting, documenting, aligning a resident's GPPs with their care delivery. Second, a tech-enabled and interoperable tool for nursing home residents to share their GPPs. And third, an evaluation plan of the process that I mentioned in the first resource, an evaluation plan of that process and seeing whether what is documented in the care plan becomes part of that care delivery. And you'll see that all of these resources kind of overlap. And another function of the literature review that Rommel laid out for us, besides finding GPP assessment tools to recommend, was to help us create kind of an agreed upon definition of GPPs that all three committees working on each of these respective resources could work off of. And when I say definition, I mean both the conceptual definitions and also the categories or the domains that Rommel referred to that we'll be asking of residents. We've put a lot of thought into collecting feedback for each of these resources. We've reached out to residents across the country for feedback on pieces of the guide. There are 2 residents who sit on the committee for the tech-enabled collection tool, whose input we really value, and it's helped us shape what that tool, that resident-facing tool, should look like. And we've also created a provider feedback committee with diverse provider backgrounds to share input on all of these resources, particularly the guide. And with that being said, I want to emphasize that these resources are in its first version. And in the next 6 months, we'll be not only finalizing these resources, but in collecting additional feedback, but also preparing for the pilot of these resources and planning out, how to better understand the usability, the effectiveness of these resources for both residents and staff. How do we ensure that it's accessible for residents, but also not put burden on the providers. And so I know we'll have lots of updates coming in the next few months. Isaac, did you have something you want to
Yeah, I
add?
was just going to add, I see a lot of just really great questions and comments about this work in the chat, and also some interest in seeing the actual tools coming out of the study. And I know Rommel said that they're working on sort of the best way to present this back, and obviously still in this process of doing some prioritization. So we'll absolutely be sharing the specifics of this work, and are really excited to do so with you and with so many more people. So thank you for that interest.
Are there any other questions that we might have missed in the chat, Isaac?
I think Rommel got to them in the chat. I will say, if you have more specific questions or ideas about this, as with everything, please do reach out to us, email us, and we can help kind of get into the weeds of this stuff. But we had one question about particular domains and how they fit into the notion of person-centered or the person being cared for, and Ram will respond to that and talked about the person-centered care and well-being domains, and also about whether the tools themselves are free. And my sense is that that is variable, right, Rommel, in terms of which tools may be free to nursing homes, because we were just drawing from the academic literature. And of course, for the coalition, that is a meaningful factor in how we think about this, right? What tools are going to be most accessible to nursing home providers and to residents and care partners as they use them. So I think so. Are you ready, Samiri, to jump into the next topic?
Sure, and I'll just add that we'll be, including and mentioning those recommended tools in the guide, that first resource in the box. And we'll write it in a way that's easy to understand how to use these tools, what's the purpose of these tools. So I'm excited to share more when we have that available.
And I'll also just quickly add that one of the concerns was regarding costs of these tools, which is why we are also releasing the set of domains and general guidance through this guide that Samiri mentioned, so that if you do not want to outsource this, you could come up potentially with your own set of questions based on the guidance and the domains that we have mentioned.
There's a question here about who's the audience for these resources, and I'll jump in and just say, ultimately the audience is the nursing homes and the staff at the nursing homes, and that they're going to be using these tools to interview and talk with nursing home residents. A lot of nursing homes do this pretty extensively now. Some nursing homes don't, and they want to do better. So that's where this is coming from.
Thank you again, Rommel, and I think we're ready to go into the next action plan, Isaac. Awesome. So in the same vein of empowering voice of residents, we have an action plan dedicated to strengthening resident councils. Very similar to the GPPs, we learned that there are some great practices that exist, and that it truly varies how it might be taking place across nursing homes. So our intent with this action plan was to build on those existing best practices and resources to organize a resident council guide and process for residents. So where are we now? We started off with a scoping review of reports and existing tools and guides on resident councils in partnership with the Pennsylvania Long-Term Care Ombudsman. The committee then reviewed all of those resources and organized a resident council guide. We collected feedback from residents, both in the coalition's resident group and also, I think, newly engaged residents, staff from several nursing homes, quality improvement organizations, and the New Jersey Long-Term Care Ombudsman. And where we're at now, we're ready to pilot this guide within 4 nursing homes in New Jersey. Starting this month, the 4 nursing homes are located in various parts of the state, are both for-profit, not-for-profit homes, range in size and CMS 5-star ratings. And in many of the homes, we've been received with enthusiasm. And I remember on one of the calls I had with a nursing home leader, they shared with us that this is something they've been wanting to do for a while, and just how excited they are to be working with us. And I know that we're excited to be partnering with them too. And so we've engaged both nursing home leaders who will be identifying more direct care staff to support this program, this pilot program, residents already in their respective resident councils, or residents who've expressed interest in being part of this program, a pilot program, New Jersey Long-Term Care Ombudsman, who have been an important partner in setting this pilot up. And New Jersey colleagues will act as kind of support people for each of the 4 nursing homes. I'll also add that the nursing homes will be receiving a small fund to support any resident council activities beyond the pilot. Thank you, Isaac. So from January to May, we'll be pilot testing the guide, which will include 3 to 4 resident council meetings. We're hoping, 1 resident council meeting a month. Our kickoff meeting will be taking place in, I think, about 2 weeks from now, this month, to start laying out everyone's roles and what we can all expect. And from May to June, we'll be taking what we learned from that pilot to refine and update the guide. If you could go to the next slide. This is a snapshot of what the guide looks like. Throughout the guide, we really emphasize that resident councils are made up of residents, directed by residents, and should work for residents. We start off with a section detailing kind of what that means, how to get started, examples of best practices, different organization tools, common challenges and possible solutions, and I think most importantly, ways issues can be addressed once it's brought up in a resident council meeting, how to close the loop, if you will. And the guide will be available both as an electronic version, but also a hard copy organized in a binder. And so with the kickoff meeting in 2 weeks, I know we'll have more updates for you, and I can't wait to share more. And if anyone has any questions, please let us know. And as Isaac mentioned, if you'd like to unmute yourself, feel free to raise your hand. We believe that's something we have to do from our end.
Can I also just share, or maybe Samira, you could share just a little bit about the process you and Alice went through to reach out to nursing homes, and how the two streams of outreach you did for each nursing home, and how important that is?
Sure. So as I mentioned, the New Jersey Long-Term Care Ombudsman were really great partners with us in doing that outreach. We carefully went through which nursing homes we wanted to identify. We wanted to make sure it was representative of all types of nursing homes, as I mentioned. And once we did that, Alice and I reached out to the nursing home leaders so we could get kind of their endorsement and commitment into this program. And the ombudsman helped us reach out to the residents to see if there was interest there. What else would you add, Alice?
I would add that the professional associations, the QIO, and actually even the Department of Public Health, we've had conversations with all of those groups, and they've been very supportive. So, you know, they've made some suggestions along the way as well.
Thanks so much. I think it's just a real, from my perspective, it's a really amazing sort of first pilot project in the way it replicates the values and vision of the coalition, and the coalitional aspect of it, right? We're really testing out that multi-stakeholder community on the ground, and ensuring that all relevant parties, and starting with the residents, with the support of the long-term care ombudsman, are included. So just really cool.
Okay.
And do anyone else have questions or thoughts about that one? We'll have time at the end for more questions and comments too. Donnie asks, Sumeri, do these 4 SNFs not currently have active resident councils?
They have, they know about resident councils, and some of them are more active than others, but they've all committed to wanting to have active resident councils. So they're not starting from zero. In some cases, we want to build on what nursing homes are already doing, so we can learn about that, and going from, you know, a nursing home that's got something going on to one that's much more advanced. But we also want to learn from nursing homes that don't have very much going on yet. So lots of learning points along the way.
Yeah, this is Jane Carmody with the John A. Hartford Foundation, and so appreciate this the focus and intense work on resident councils. Alice and team, what do you think this is one of the key driving points to quality in a nursing home if they have a strong resident council? I mean, in my experience, it's been like they hold us accountable for, you know, for the care provided and the services and the, you know, all the activities. I just wondered what you have seen in terms of impact to improving quality in the long run. I know it takes a while if you don't have one to get it up and running, but.
I think it's a great question, and I'll answer for myself. So I'll answer as Alice Bonner, longtime nurse practitioner in nursing homes. I think it really depends on the culture in the nursing home and how much the nursing home supports and promotes and actually makes the resident council a major part of what the community is, because you know, if a few of the residents participate, but the nursing home leadership, the administrator and DON and social worker, if they're not really bought in, then it may or may not be effective. I think the potential for this to be a game changer is absolutely there, because as we're talking about person-centeredness and teaching about it, as we're talking about goals, preferences, and priorities and teaching about it, and the other things that moving forward, and many of our colleagues on this call are doing, I do think it really does make a difference. And Michelle Mosia from Michigan chimed in and said the resident council can also be a forum on how they can best articulate their GPPs. Absolutely true. Great example. So, so I think this has real potential. It's going to need some resources to make it happen, but I think it's worth it.
Fantastic. Thank you, Samira and Alice, for sharing about that. So I think we'll hop to our next of 3 action plans that we're sort of highlighting today. And that is financing household models and physical plant improvements. So one of our action plans is focused on that, and in particular, trying to expand access nationally to private rooms and private bathrooms, community space, outdoor space, and other aspects typically associated with what are called householders, small house models, that improve safety, quality of life, and a sense of dignity for residents. So we had 2 work streams that are focused on this. One is really thinking about a federal change that can be made to incentivize nursing homes to take existing structures and transform them into these newer, more innovative, more home-like models. And one is focused on state activity. So I'll briefly describe both of those work streams of the coalition. The federal work stream is focused on the HUD 232 program. HUD 232 program, for those who don't know, is a mortgage insurance program. So the federal government insures loans from private lenders to nursing homes for either new construction or renovation. And those loans are really important because typically without them, the lenders would not provide resources to nursing homes, or at least sufficient resources to undergo these sorts of projects. So in 2021 alone, HUD, and particularly its Office of Residential Care Facilities, insured $4.9 billion with a B dollars in commitments. So this is HUD is not itself financing these projects, but it is creating the ability to bring capital into nursing homes for these capital projects. So it is a really big and often under-discussed component of the way the federal government finances nursing homes or supports the financing of nursing homes. But what we've felt is that this program is not really being fully leveraged to improve nursing home quality. It's giving nursing homes dollars to do construction and renovation, but it's not telling nursing homes the sorts of quality improvements they should be including in those projects. So it's not necessarily, doing the federal government's job of driving nursing home quality improvement in alignment with much of what the Biden administration, for example, has said they want to see around infection control and quality of life. So we have worked with the Healthcare Mortgagee Advisory Council, which is an association of lenders, to outline 3 proposals that HUD could institute in this program, really in the next year. We were very specific about wanting it to be near-term changes to introduce some incentives to drive nursing homes, to create the changes that we want to see in their physical plants. We would be happy to dive into the specifics of those 3 proposals. They do get kind of technical, but the idea of all 3 of them is, how do we make the terms of the insurance package more favorable for nursing homes that are committed to, say, going from all double bedrooms to single private bedrooms. So nursing homes that we're going to go out and make those positive changes would receive better terms on their insurance for the mortgage. So reached out to HUD with those and continue to our dialogues with them and to really engage them on whether we can achieve these goals. And we've learned a lot and I think started some really productive dialogue in the process. So that's our federal stream. And at the state level, we're having a lot of the same conversations. What we found is a lot of the movement on this is happening in pockets in states. So there are states that maybe have an increased reimbursement rate for private bedrooms. There are states that may have some quality incentive payment program funding around innovative physical plant changes. There are states that may leverage direct grants or who have historically leveraged civil money penalties to support this work. But those ideas are very fragmented. They're kind of all over the place. And so we're pulling together some representatives from a few states, from their Medicaid programs, from their departments of health, from different areas to talk through these ideas and really understand what are sort of the top 5 approaches states could take to incentivize these sorts of changes. So the first meeting of those state leaders is on January 11th, so just a week from today, and we're really excited for those conversations and to learn from those colleagues and hopefully write them up in a way that will be useful for advocates and others going forward. So that's our work on household models and other physical plant improvements. Any questions there?
There's a question from Monica about IPC and quality improvement. What's the HUD piece? Or is there a multi-agency play? Yeah, I mean, we absolutely are in conversations with CMS, multiple conversations with them. And you're bringing up a really important point, which is one of the challenges is HUD, which sees itself as housing, doesn't always talk to CMS, which sees itself as Health and Human Services. And that's a big problem. I would say also Department of Labor, Department of Education, when we start to talk about the workforce stuff, same challenges. So we've been really trying to think about interagency work at the federal level. A number of our steering committee members have really focused on that. And, I think the conversations with HUD have been challenging because they don't see nursing homes as a big part of what they do. So I think Isaac and the team have done a terrific job keeping those conversations going, finding new people to connect with. And this has been over many months that it's still happening. So we hope so.
And to add to that, the Biden administration's fact sheet and executive order around nursing homes in 2022 should be a real boost to these efforts because it does say that this is a priority of the federal government as a whole. And that needs to be a cross-agency effort. So we are trying to leverage that, but it is about sort of taking to really showing that HUD has some power here and can create real change. That's also in alignment with their mission to create better housing for people nationally. Because as we like to say, and as is absolutely true, nursing homes are people's homes. Nursing homes are people's homes. So it is absolutely part of housing to improve the quality of nursing homes. And
I would just tie back to, what Isaac has here on the slide about different states. We're doing some work right here in Massachusetts where the 3 of us live, with the Massachusetts Housing, Department to try to do some things here. So whatever state you're in, there's an opportunity there as well.
And I'll say, Monica, I'll put our email in the chat, which goes direct to my inbox. And maybe you can shoot me an email and I'd love to connect after the call. Okay, fantastic. So now we'll talk a little bit about our efforts around state teams and particularly do a highlight. It's great to see Michelle here on some of our work in Michigan. So I'll turn it over to Alice. And it looks like we're on track to also have some time for some discussion at the end. So
Great. Thank you. So yes, we have not only Michelle Mosia, but we have Cheryl Huckins and Sarah Slocum, Nancy Swires, and Linda Keilman, all from the Michigan State team. So we're super excited. We also wanted to say, Pennsylvania also has a state team, and Isaac and I are very involved with Nancy Zions and the Jewish Healthcare Foundation there. So lots of work going on in multiple states, but we are highlighting the work in Michigan because it's the farthest along. So next slide. So again, we have a number of different things going on in Michigan. So over the last 6 months or 6 or 7 months, Michelle and Belinda Dockick and a number of people have been leading a state team in Michigan to build out the expertise and the people who care about nursing homes and want to focus on nursing home quality and want to really focus on getting people together throughout the state of Michigan in a way that gets rid of some of the fragmentation of having lots of different programs that don't always necessarily come together and talk with one another. And it's been really amazing to watch. It's a fantastic team. They get on calls every 2 weeks. They've done terrific work with key informant interviews in a bunch of nursing homes, sending a survey out to a bunch of nursing homes about goals, preferences, and priorities, and other really wonderful things. Next slide. The other thing that we've been doing with Michigan, separate initiative, is we've been working with the state survey agency, which is called LARA, and they invited us to present on April 9th and give a full day presentation, 5 hours, on person-centeredness, primarily for surveyors, but also they invite providers and others to join. And we're really excited to have an opportunity to get in front of all of the surveyors in Michigan because it's required day of training. And I'll be going up to Michigan. Doug Pace, who's one of our co-chairs, is going to be co-presenting with me. And we have a number of other coalition members who will be part of that, including people on our Michigan team. So really excited about that. Next slide. The other ways that these things are coming together are that, you know, we now have received funding for 2 more years of work in Michigan. And that comes from the Michigan Health Endowment Fund that funded the first 6 months. And they wanted to see what we could do to build out the team. And based on the results, they ended up funding us for 2 more years to focus very specifically on leadership and quality improvement. And the goal of this work is going to be to have the Michigan State team, and again, people from the Michigan State team can chime in here, you know, to build those skills among those team members, and then have those team members go out to a set of maybe 5 nursing homes and really work to understand how do we implement more leadership skills and training and more quality improvement skills, for example, to be able to do performance improvement projects and things like that. So we're very excited about this work. It started January 1st. It started this week. And we're really, you know, setting everything up to be able to work collaboratively in Michigan. So again, I'll invite anybody to chime in here. Robin asked if there's a state team in Connecticut. Yeah, not yet, but we do have really strong partners in Connecticut. Marie Painter, who's head of the Ombudsman program. We do work with Barbara Cass and other people at the state. And there's a very strong leading age chapter and others. So I would say, you know, it's definitely you know, something we could do. And if you're interested in taking the lead, let's talk, because that would be great. Is there one more slide, Isaac, in this section, or not?
I think you've reached the end of that section, but just
Okay.
Michigan has been a really momentous place for us to be working, and it really did begin with the wonderful work of Michelle and the state team, and just blossom into some really amazing work streams that, as you can see, have, you know, picked up on our person-centered care surveyor training action plan and really run with that, and supported our goals, preferences, and priorities action plan and really run with that, and also developed some fantastic exciting initiatives around leadership with the support of the Michigan Health Endowment Fund. So we're super excited about the work we're doing.
And does anybody from the Michigan team want to unmute and say anything to the group here?
Come on, somebody must have to say something.
I know, Michelle, it's got to be you.
No, there's so many Michigan people that are on this call. It's so exciting, you know, that people have joined. Well, we want to just say how grateful we are that we were selected to be able to participate in this great work. We're really humble. We've been excited. We started with 10 people and then we just grew, and we've all been really engaged in this process, and we're very thankful for the grant that we received and what we're going to be doing in the future. I wish somebody else would say something about the process.
This is Sarah. I was trying to unmute, so sorry I couldn't talk earlier. I've been part of the Michigan team, not from the very beginning, but for several months now, and I think we've gone through a really good process of coming together as a team, and it always takes folks a little bit to learn how to work together, just what are each other's styles and where the strengths. And I think we do have some really good strengths across different spectrums of the Michigan long-term care community. We have some academic folks. Of course, we have people who actually provide nursing home care day in and day out, which we really value. And then advocates, and I'm on representing the Michigan Long-Term Care Ombudsman Program. So it's been, I think, a great selection. And of course, Leading Age has been involved in Healthcare Association of Michigan. It's been a really good selection of a variety of people to be involved. And I think the timing is good for this next 2 years. We've had our initial period, as Alice said, to make sure that we can really work together. And now with resources, very excited to head into 2 years of hard work, but that's what we love. So anyway, thanks for including.
I don't think we can say this enough. This work was happening way before Moving Forward was even in existence. Michelle Macia and her team have been leading this work with lots of other colleagues, Sarah and others, for a long time, and it matters and it makes a difference. And you can tell just by the chat here today, people are asking about Connecticut, people are asking about New York. We can do this in other states. That's the whole point, is if we have people who are willing to take the lead and do this, we can help put together these teams. Again, the team in Pennsylvania is very independent. They do things really a lot on their own in a good way. They're supporting the work. So I would just say, please reach out to me or Isaac. We would love to talk with you more about how we can support those ideas.
And I see two more hands. Jane, Dr. McNeil, go ahead.
Yeah, so I was trying to say something, but I couldn't get out of mute. But yes, I am from Michigan. Yes, I'm representing the academic side and looking really for those academic clinical partnerships with long-term care facilities and entities that advocate for long-term care facilities to improve care, to increase the geriatric workforce. I mean, we are really excited about this work that is being done, and we are actively looking for other ways to kind of catapult this initiative to, like I said, increasing the geriatric workforce, getting more providers interested and involved in geriatric care, improving the quality of care. All of those things are in the works in Michigan.
Fantastic. Thank you so much. I apologize. I missed your name on the list of Michigan people. So thank you. Thank you.
And Jane.
I hate to take up time. I see Sarah has her hand raised again. Dr. McNeil, wow, this is great. And I just want to lend a note that we're fans. The foundation is fans of Michigan. We have co-funded with them on a lot of things, certainly age-friendly, everything, as they talk about. So we're really appreciate their work in doing this and their commitment and all this great talent that's going to lead that way. And of course, always a shout out to Michelle. She is just a hero of mine. She's helped us with many, many areas such as geriatrics ED care. And now for her focus on nursing home is just so appreciated. So Alice, I did mention to you that Dr. Phillips, Cheryl, was on the call. I think she had to leave early. She's our new geriatrician that's on the team here at the Johnny Hartford Foundation. And she also has some contacts in Minnesota. So as you say, Alice, state by state, we'll keep adding them on, and pretty soon it'll cover the country. So this is just great work, and thank you to the team.
Fantastic. Sarah.
So I will just tag on to my own comment a little bit about how the team has come together. I will say that representing the Ombudsman Program, we represent the voice of residents, but we're a little bit of an indirect representation of the voice of residents. And I look forward to finding more ways to directly include residents, gather input from residents as we work with the 5 nursing homes in our ongoing project. And I think this project gives us, a little bit elbow room and bandwidth, because it's always a challenge to get input directly from residents, but I'm looking forward to some focus on that as well. just wanted to add that. Thank you.
Thank you. And we did have one of our residents, Marguerite Gruch, was on the call. I think she may have had to drop off, but yes, it makes a huge difference on these calls when we have someone who is a nursing home resident, someone living in a nursing home, and we value them tremendously. So thanks for reinforcing that. That's great.
Fantastic. Well, so it's been really great to have all that positive energy about the work in Michigan, which has been really fantastic. And so, kind of for a last slide, we just wanted to do an exercise of really looking at all the progress the coalition has made, and just really over the course of the fall, from August when we got down to business on these action plans after launching them in July, to December, which is now just behind us. And so, just some highlights we wanted to share, some of which you've now seen, but I'll read them out, and you can see the action plan that they're relevant to on the right. So as Rommel talked about, we completed a lit review of existing nursing home care planning tools, and identified priority GPP tools to be integrated into the coalition care planning guide. In Michigan, you just heard about this. We're partnering with Carmen Bowman, Lara, the state survey agency, the Ombudsman program, to provide a full day training on person-centeredness to Michigan's nursing home surveyors and providers in April. In our work on health information technology, we're doing a really extensive review of the tools, the technology tools that nursing homes need by the time we get to 2030 to really be integrated into health systems, and data exchange landscapes. We've gotten to share our insights into CNA career pathways with CMS's Office of the Administrator. And we're also really excited to see some progress at the Health Resources and Services Administration to include career pathways in their notice of funding opportunity for the Geriatric Workforce Enhancement Program for the coming cycle of 5 years. And they've actually specifically called out CNAs as a direct care workforce group that could benefit from focused work on career pathways. So lots of amazing progress when it comes to advancing CNA career pathways. We talked about our work with HUD, and really presenting some 3 super concrete policy changes that they could make this year to incentivize household models. We've talked about our resident council guide, and we're really excited that we're piloting that amazing piece of work in 4 nursing homes in New Jersey starting this month. We're also excited that CMS on its own has taken on some of our work on survey, targeted survey. I'm going to start that sentence again. We have an action plan on developing a targeted survey for high-performing nursing homes to create efficiency of the process. We know there's a really large backlog, and to also make sure that surveyors have time to engage residents both during the annual recertification survey and as a response to complaint surveys. And we're really excited to see that CMS has announced that it will be piloting some really similar work in 2024. And to us, that feels like some really great progress, and we're excited to share some more specific ideas with them, both on an upcoming call and also, hopefully in future forums. And then just one more thing, we've been really laser focused on improving nursing home transparency and accountability of ownership data. And we're excited that we've been invited to present to the Oregon State Legislature on some state policy approaches to improve that accountability later this month. So that's a really exciting opportunity for us to present what, if a state wants to improve their systems for ownership, accountability, and transparency, here are some rules of thumb and best practice approaches they should consider. So that's just some, 8 really things we're really excited about that have happened in just the last few months. And, as we move into 2024, we're excited to, double and triple these efforts to continue making some really tangible change in nursing home quality. So with that, and we have still 10 minutes, we'll turn it over to the group for discussion. Please raise your hand so we know to see you to unmute you. Or you can put questions in the chat, and also highlight that here are just a couple of, or a few places we'll be in the next little bit that you could come find us if you'll happen to be there too. So Alice, I don't know if you want to facilitate discussion.
I'm happy to, we can all, I know Marguerite is on the call. I didn't see her name a few minutes ago, but maybe if we can unmute her, if she has anything that she'd like to add. I don't know if she does, but I just wanted to make sure to give her a chance.
Sure. I just wrote in the chat as well that I'm very encouraged by the many things that have been put in motion. I've looked at a number of these things that came out of different committees, and I hope that going forward, residents will keep being included in the process.
I think I would say included, and we want to enhance that too. We want to really promote more residents being involved, being actively involved. And that's not only on committees. I mean, committees and work groups is one way of doing it. Marguerite, I know you're very active on the committee, but you know, any other, you know, reviewing documents, giving feedback on documents, those kinds of things. We're going to have a lot more of those opportunities coming up. So really, really appreciate it. What else, what are any of you thinking about or wondering about that we did not talk about today? There might be something else, one of the other action plans that you're wondering about. People are still coming back from vacation. I know it's always a challenge. I don't know if anybody else wants to talk about some of their initiatives. I know I see our colleague Wendy Fox-Grage is on, and they've got some new activities and continuing activities that we've had ongoing conversations together. So Wendy, I don't know if there's anything you want to add here.
I'm so happy that I joined the webinar to hear about all the exciting things, and I want to hear how it goes with the Oregon State Legislature and your presentation there. And I'm looking forward to working with you more in 2024. You've got so many hats in the fire here or in the ring, and so I think it's great, and I might have some ideas for some more states that would be willing to pilot some of these things. So let's talk soon.
Okay, fabulous. Thank you, Wendy. That's great.
For some reason, I don't know why I'm so challenged today, but for some reason I can't figure out how to raise my hand again now. So
well, that's all right. Keep talking.
When I do, yeah. So what I would just wanted to say, first of all, I think it was Julie Bogest that talked about regulations being the biggest barrier. And I didn't know if that meant regulations that the ombudsman had or regulations just in general. I just kind of had a question about that. And then Alice and team, what you presented today is the highlights of all of the work as you went through each month, and then you kind of focused on some of the highlights or the areas that are really moving forward and really have made an impact and will make an impact. And as you mentioned, Isaac, once there was something that you said kind of ahead of us, or the White House had done something, because I do think it'd be great to see, and maybe you already have a listing of all of this, all of the activities that is going on. It just seems like there's quite a momentum. And I think, I don't want to give you credit, but I would like to give you credit that a lot of this is happening because of your constant efforts and work and traveling the country and presenting, and then the next one coming up. And so I just want to make sure that we know everything that's going on in a good way for that. I will also just add a small note. I'm from a health system, and we implemented patient advisory councils That was a big thing a long, long time ago. And I will tell you, they made a huge impact. We eventually did not do anything that we didn't run by the patient council. I know it's a little different, and I know there's more at stake with a resident because that's where they live. But I would just think your work here and the strides that you're making, I think will really make a difference to quality in the long run. So congratulations.
And Nancy Kusma put it. Do you want to say more about that executive order, Nancy? That's pretty exciting.
I don't know a whole lot about it yet, other than the fact that we're talking about it in the context of our master plan on aging here in the state of Maryland. But I think that one of the big things that our multi-sector plan is looking at is breaking down silos between, aging services and health, which I think has a lot of potential for improving nursing home care in Maryland, but going to be a long road.
Mm-hmm. And are you going to be involved in? Might you be involved on the committee that's going to be developing that longevity plan?
Not at the moment. I'm doing I'm on an advisory panel, but not on the multi-sector plan panel.
Well, thanks for reporting on that. And we have a couple of other committee members, Claudia Balog and a few others who are involved in Maryland too. So we'll keep an eye on that for sure. Julie, you have your hand up.
Yeah, thank you. I just thought I would respond to the question about that I put in the chat about regulations. I was really pleased to see that Michigan surveyors will be included in person-centered care training. My comment was primarily related to federal regulations for certified Medicare, Medicaid nursing facilities that try to operate person-centered care cultures, but under the weight of the regulations that quite frankly are anti-person-centered care. So, and then the second layer of issue is the way that those regulations are often interpreted by the individual surveyors in each individual nursing facility. So I think there just needs to be a lot of work done to educate CMS, to educate the surveyors about what nursing home people are really trying to accomplish and to unwind the medical model and make regulations more supportive of person-centered care.
Well said. Thank you so much. And, some of those regulations are really old and they're just from before the time that we even talked about person-centeredness. So we have a lot of work to do, but your points are really well taken. I know we only have 2 minutes left there, Isaac, so I'll turn it back to you. I think this has been a great call, lots of information. You guys have shared a lot of information. We love hearing from you. We love hearing your ideas. We're always interested, even between these calls. You've got my email, Isaac's email, Sumeri's email. Email any of us anytime and just let us know what you're thinking, any ideas you have. We're, as you know, doing strategic planning for the next couple of years. So it's a really good time for us to hear from you. So Isaac, over to you.
That wrapped it up so well. Thank you all for joining us at the top of this really promising new year. And we're excited to make some change with you between now and 2025. So wishing you all a great rest of your Thursday and hope to see you again on our next call, if not sooner.
And Michelle, thanks for bringing the baby.
Very, very cute.
Yes. Awesome.